My name's Carmel and I'm a staff nurse on a trauma orthopaedic ward. We look after all kinds of people from all walks of life who have had injuries, where they've broken bones and possibly need an operation or rehab and physio and occupational therapy before they can go home. At the moment, our patients may be that they have hurt themselves and come to the ward and still might have a diagnosis or symptoms of COVID-19. So we don't know how that is going to work or how they will present and how we will look after them. I suppose being a surgical ward, we have that consideration that we have lots of wounds to look after and we have to be very clean and will we have enough PPE to go round to protect us and our patients and everyone else that comes through. People are frightened about going to work and I am as well. I have people at home who rely on me. I have my mum and dad and sister and my son, and we all have complex health needs. We have some respiratory needs in the house. My mum especially has COPD, and I'm worried that if I go to work, am I endangering her by bringing something back to her, and what if she gets sick? But then I need to go to work and I need to help everyone there as well. So I'm conflicted and worried and feeling guilty about being conflicted and feeling guilty about being scared. And I think my mind's a little bit of a mess at the minute. I've had a really tough day today. I had a patient who came in with a broken hip and with symptoms of COVID-19. An elderly lady who was in lots of pain and quite hard of hearing, and her eyesight's really poor. So she must have been really frightened seeing me in a gown and a mask kind of coming towards her. Obviously visiting hours are restricted so that we can limit the amount of people coming into the hospital, and I totally appreciate that. But I just really felt for this little old lady. She was really frightened and I just wanted to squeeze her. Which probably wouldn't have been appreciated because she got a broken hip. So that was really difficult, and I spent a lot of the day looking after her and a few other patients who were frustrated possibly at being kind of in a lockdown situation where they couldn't move about or do anything because we were worried about their symptoms, and one had a high temperature and being in a lot of pain pre-operation is really difficult, and I understand that. Just trying to get the message across to them that we were all doing our very best was really hard. Hopefully tomorrow will be better. So I volunteer with the Royal College of Nursing, and I am active within our branch, and I am a steward within my hospital. And over the past few days I've had lots and lots of messages. I'm probably up to about 250 messages now from people who are frightened about coming into work and frightened of staying at home, frightened of what's happening with their families and what would happen to them if they go off sick. So I put a little shout out on social media this evening just to say thank you to everybody for being amazing, and I hope that goes down okay. And maybe it's my job at the minute to just try and bring a little positivity. We'll see how I can do that. So we've just been outside and the whole street has been clapping for our Clap Our Carers time, and I'm just massively overwhelmed and really grateful that people are recognising what's happening in the NHS and across the care sector at the moment, and the people are working really hard. I hope everybody in my branch and within my teams has seen this, because I think people really need a massive uplift at the minute. I'm actually just really overwhelmed. So yesterday I made the decision to move out of my house with my mum and dad and sister and my son in order to keep them safe. So I have spent the morning unpacking at my other sister's house, who is also a nurse. So we will be living together for the foreseeable future. And I have left my family behind so that they can be safe and away from infection. And I am utterly heartbroken. So I'm just back from work, a long day, and I'm tired because it really was a long day today. Not necessarily because of the workload. We're actually really calm. It's quite eerie. We're a busy hospital. We're a popular hospital. We're normally bursting at the seams, and obviously we're kind of clearing beds out now and making spaces for people. I think accident and emergency is probably being used correctly for the first time in my lifetime. Nobody's sitting in A&E for a long time because they can't get an appointment at the GPs. Everyone's using it properly. It's for serious accidents and emergencies only. So that's what we need at the minute. We need that kind of space to breathe a little bit and to give those departments time to deal with the people who really need it. We've still got trauma and orthopaedic cases coming in. No electives, so that's been different. And our staff team has kind of evolved as people move to where we're needed most. This is going to hit. It's going to be really scary, and we're going to be really, really busy with lots of poorly people. And there's nothing that we can do to kind of stop it at the minute. We're just waiting. And it's really weird. It's a bit frightening, really. So working from home today, conducting some interviews for potential nursing candidates. And I kind of thought I was on top of things when one of them was really kind and told me to take care and to stay safe and hope that me and my colleagues were doing okay. And I just kind of had to end the conversation really quickly before I burst into tears, because obviously just an emotional wreck at the moment. Still missing Jack loads and trying to FaceTime and help him with his schoolwork over the phone. It's really weird. I'm never far away from my family, and this is really difficult. Strange day in work today. Lots of staff off sick and people, having symptoms, and still very frightened. So it's quite scary. It's kind of edging closer and closer to us. I've empty beds on the department as we make way for people who need to come in, and they are coming in. Different rules for PPE today. And an email came around last night and said, we were all to wear masks all the time and to change these every 3 hours. And obviously different if you're going into a room with somebody who's possibly infected. So that was kind of strange, and you have to relearn the levels of communication that you use. And I don't think you realise that how much of your non-verbal cues that you're looking at and how much we rely on facial expressions. And it's not until that's taken away from you that you realise how difficult that is, especially with my some of my mature patients who have difficulty hearing. They rely on looking at your mouth to interpret what you're saying. And then once you take that away, you've taken away a massive proportion of somebody's face and then ability to communicate, and quite an expressive person. And all those things that you say, you're having to try and get across to somebody with your eyes. My little old lady who's got a broken hip, and I want to tell her that everything's okay. And my facial expressions will play a massive part in that, and that's gone. And try not to be terrifying as I come towards them looking like something out of E.T. Anyway, we're all just doing our best, and that's what I think is coming across more and more, is that people are pulling together and trying our very best for our patients, which is what all of us ever wanted to do when we signed up for this anyway. It was my dad's birthday, so my sister picked me up and we went to the gate and waved and sang happy birthday to him, and got the shopping list for tomorrow so they don't starve while we're not there. So that was a bit surreal, kind of talking to my family while they were stood at the front door and we were stood at the gate posts. But that's the way it's going to be for now. And when this is all done, well, it'll all be amazing. And I can't wait to give my son a big hug and a kiss, because I really miss him. And I love him. And I love him always. So I am menopausal, and that means that when I am in work, I am roasting. So I wear my hair up in work. I've got long hair, and I've been wearing it in space buns. And I kind of got laughed at, called Princess Leia and all that. Oh, well, no one's laughing now. Because my space buns, instead of hitting my ears with me face masks, I can hook it round my buns and it doesn't ruin my ears. So now everyone's coming in space buns now. Oh, last laughs on me. Woken up to the news this morning that a nurse in Liverpool has died. There's just no words, is there? One of our nursing family has gone. My heart breaks for her family and friends and her colleagues. So sad, so awful. And it's all creeping a lot closer to home. Oh, God bless her. God bless her.